that 1% of the overall genomes that have been sequenced being of African descent, some of that is about access and some of that is about trust. Henrietta Lacks, Tuskegee, and things like this. And I have to assume that one of the reasons why these large pharma companies are coming to Meharry is because they know that these trust issues are there. And schools like Meharry are critical. If we're going to make any progress, it has to come from institutions like this.
Today's PSA marks the conclusion of Season 1, and I'm excited to welcome back Marcus Whitney, a familiar voice from the start of the season. As we wrap up, I want to take a moment to reflect on both the themes we've explored together and the future ahead, looking at what's next for healthcare and the conversations we'll continue to have. My name is Dr. James Hildreth, and you're listening to Public Service Announcement. In this episode, we discuss the future of healthcare and education, reflecting on the transformative changes ahead in both fields. I'll share my thoughts on how healthcare is evolving and what it means for the next generation of professionals. As I near the later stages of my career, while many young minds are just beginning theirs, I hope my journey can inspire others to reach their full potential. Thank you to everyone who has tuned in for Season 1, and I look forward to continuing this journey with you in Season 2. And continue to make healthcare topics accessible and engaging for all. To learn more about this show or to learn more about Meharry Medical College, visit www.mmc.edu. Marcus, so good to see you again.
Thank you for having me. Before we dig in, how has this process of launching your first season of this podcast been for you?
Well, it's been quite interesting because it never would have occurred to me to do this, but my young colleagues at Finn convinced me it would be something worthwhile to do. And I guess it was sort of built on the fact that during the pandemic, I was the voice of science for the community, and people seem to appreciate that. But it's been an interesting process, choosing the guests, choosing the topics. But I've just had a wonderful support from Alexis and all the others at the Finn team. So very grateful.
That's awesome. You're seasoned at this now. When we started, it was the beginning of your maiden voyage, but you are seasoned now.
Yes.
So let's talk a little bit about what it has been like to be Nashville's doctor. It was one thing, obviously, during the pandemic. You were kind of thrust into that role based on your experience and the very severe circumstances we found ourselves in and all the work that Meharry did to get COVID testing going up and running for the community. But obviously, we've evolved pretty far from where we were then. But I think people still sort of view you as Nashville's doctor. So what's that like today in the summer of 2024?
Well, first of all, Marcus, Mayor Cooper should have checked with me before he gave me that moniker, because you don't want to come to me for your clinical care. I haven't seen a patient in quite a long time, but it felt good to me to have people know that they appreciated the science and my explanation of how the science was involved in all this. I used to make the comment that if you've been studying something for 40 years, and I've been studying viruses and the immune system for decades, if you don't understand it well enough to explain it, that will be a problem. So I just felt very fortunate to be able to bring to bear in a very useful way this thing I've devoted my whole life to. And I also think that Nashville, being the healthcare capital of the country, made it even more special for me to be in that role. So it's been great. And I think Meharrians, both here in Nashville and all over the place, felt a sense of pride that their chief cheerleader was in that role. And it's been great.
I know that you have a great relationship with Senator Frist,
Yes.
and you serve on the board of Nashville Health. Can you talk a little bit about how you brought that Nashville's doctor position into your work, working with Senator Frist for Nashville's Health?
So I think, of course, Senator Frist is well known for his interest and concern about the health of Nashvillians. And when I came back to Nashville to be president of Meharry, Senator Frist is one of the first people I reached out to just check in with him and get his perspective on some things. And he reminded me that even though Nashville had become the it city, it was not a very healthy city. And there were some things that he wanted to address, smoking, obesity, and other things. But having Senator Fritz as a colleague and being part of the organization he's created has been very insightful for me because I've learned a lot from him. But I also like the fact that he has made sure that Meharry had some standing in all the things that he's doing, because that wasn't always the case.
When we last talked, you spoke about kind of two things. One, the importance of Meharry's mission, it being very, very unique in the way that Meharrians think about care for communities, as well as the impact that artificial intelligence was going to have on the world more broadly, but certainly on healthcare. And so since then, you've launched two new schools at Meharry.
Yes.
You've established the School of Applied Computational Sciences and the School of Global Health. Can you talk about each one of those schools and maybe where there's some intersection between those two?
Sure. So when I started as president 9 years ago, it was my strong, firm belief that data science and artificial intelligence were going to be really important in the delivery of healthcare, but also in biomedical research, all those things that we do. And in order for there to be innovation, there has to be some facility with these things. So I really wanted our students at Meharry Medical College to be exposed to and possibly get excited about what data science and artificial intelligence would bring to the table. So we started out with a data science institute. Then I was very fortunate to attract just an amazing individual from Lipscomb, Dr. Fortune Maslanga, who convinced me that instead of just having an institute, why don't we create a school?
Wow.
And I was a little bit nervous about it, I have to admit, but Dr. Maslanga came in, laid out a beautiful plan, and in less than 2 years, I believe, we went from an institute to a school that was fully accredited by SACS. And the whole idea is to attract faculty members, and we've done that in areas of data science, biomedical data science, artificial intelligence, to create programs that all students on our campus can benefit from. And that's been my charge to all of our deans, to create intersectional, interdisciplinary programs, because I think innovation will happen when people from different disciplines get together to focus on the same problem. And we applied that to our new School of Global Health. Also, when I first started, I mentioned to the campus about something called combinatorial innovation, which is a phrase I think was termed by the chief data officer at Google, chief innovation officer maybe, where people from sometimes widely different would come together to focus on the same idea. So what does this have to do with the School of Global Health? We were going to start a School of Global Public Health, but it turns out that the accrediting body for schools of public health was very prescriptive and restrictive, I might say, in how you would organize the faculty, curriculum, and all that. We believe that to achieve health equity is going to require people from vastly different disciplines to come together, data scientists, epidemiologists, political scientists, health policy experts, and we want them all to be part of our school so the students can actually see in real time what combinatorial innovation looks like. And this part comes from my own experience in HIV work that I've done for the last, almost 40 years. And once it became obvious that this was not going to be solved by physicians, scientists, or physicians alone, and we had to get other organizations involved, one of my proudest achievements was convincing pastors of churches, especially Baptist churches, to allow me to stand in their pulpit at the 11 a.m. service and talk about penises, vaginas, sex, and all that. That was an amazing thing, right? But when we got faith leaders involved, community leaders involved in the fight against HIV, that's when things really took a turn for the better.
Right.
And we want to do the same thing for achieving health equity by realizing it's not just going to be public health professionals, but people from many, many disciplines collaborating to make it happen. And that's the whole basis for our new School of Global Health. And our founding dean, Daniel Dawes, has done just a great job of hiring people across those disciplines to make it all work.
Daniel's reputation is moving very, very quickly in a positive direction.
Yes.
Everywhere I look, someone is talking about the work that Daniel is doing. So congratulations on recruiting him. I know he was, highly sought after talent.
Yes.
So congratulations on that.
Thank you.
I think related to sort of the intersectionality of what is going to take to achieve health equity, let's talk about the Together for Change initiative. It feels like one of the capstone moments in Vanderbilt, sort of establishing its role in the future of personalized medicine, was the achievement of its biobank.
Exactly.
Right? So maybe let's talk about the origin of the idea and now the path of execution.
So we were approached by a leader at Regeneron about this idea of recruiting 500,000 people of African ancestry and sequencing their genomes to create a unique data set. And so I know a little bit about this because when I was at UC Davis, I got exposed to data science. They had a Human Genomics Research Institute there. And, when I'm in a room, I may not be saying much, but I'm just absorbing it like a sponge, right? And I went back and did my own research to come to the conclusion that when data science and artificial intelligence meets large genomic data sets, some real amazing discoveries are going to be made. The problem is that the first genome was sequenced. It wasn't really fully sequenced, but let's just say in 2003, led by Francis Collins. That took a decade. Hundreds of scientists were involved, and I believe it cost more than $1 billion to sequence the first human genome.
Wow.
Since that time, thousands of genomes have been sequenced from humans, and the problem is that only about 1% of those genomes come from people of African ancestry. So the problem is that once we start to apply these powerful tools that have been afforded by data scientists and artificial intelligence investigators, we're going to make discoveries about disease origins, therapeutics for diseases, maybe even some multi-gene diseases like cancer. Because cancer is not just one disease, it's lots of diseases or lots of individual mutations that result in that condition. And it's been really challenging to put all this together, but I really believe that with the tools, again, of artificial intelligence and these data scientists who do amazing things, some astounding, unexpected, amazing discoveries will be made. But the problem is that if we're not represented in the data set, those discoveries, those treatments won't be as useful, not nearly as useful for us as they will be for people of European ancestry. So over a 3-year period, we came to an agreement with 4 large pharmaceutical companies, Regeneron, AstraZeneca, Novo Nordisk, and Roche, to do 2 things. One is to create this amazing data set of 500,000 people of African ancestry. The second thing, which I'm really excited about, is to create programs for K through 12 kids and undergraduates to have them be exposed to and get excited about genomics, data science, artificial intelligence. I hark back to an experience I had as dean at UC Davis. I went out to visit elementary schools and middle schools to talk about science and my work. And in one of those schools I went to, I walked into a 3rd grade class, and I quite honestly did not know what these kids were doing. And then the teacher saw the puzzlement on my face, and she pulled me aside to say they're writing computer code. So these were 3rd graders writing computer code as if they were just doing their ABCs. And it struck me that in none of the other schools had I visited, which were much less resourced than this one, were the kids in 3rd grade writing computer code. And so I determined in my mind that if I had the opportunity to do so, I was going to make sure that kids from disadvantaged backgrounds and not necessarily the best resource schools would have a chance to do this. First of all, it's really exciting. And secondly, if you expose children to these things and they get excited about it and they see people like them doing it, they'll believe it's possible for them. And so we're getting a grant from these 4 pharmaceutical companies to set up programs to expose K through 12 kids to all the amazement and wonder of data science and genomics. And I'm really excited about that.
That's powerful because it ties back into your upbringing story and the importance of education and the women in your community who sort of made sure.
Absolutely.
So it all connects and it all makes a lot of sense. Can you talk a little bit, and I want to kind of recall what you just said about being on the pulpit at 11 a.m. and being able to talk about,
Yes.
sex, right?
Yes.
Because this is part of how God made us to continue to reproduce, right? That 1% of the overall genomes that have been sequenced being of African descent, some of that is about access and some of that is about trust.
Absolutely.
We talked about Henrietta Lacks and Tuskegee and things like this. And I have to assume that one of the reasons why these large pharma companies are coming to Meharry is because they know that these trust issues are there and that schools like Meharry are critical if we're going to make any progress in this.
Absolutely.
It has to come from institutions like this. Can you just talk a little bit about that recognition?
So, Marcus, you're absolutely right. And the folks at Regeneron made that clear up front that the reason why they chose Meharry as a partner because they realize that we are trusted by, and have been for a long time, people in the African-American communities, not just here in Nashville, but all over the country. That goes back to our foundational mission of making sure that Black folks in the United States had a place to go to become healers. And so we earned that trust over a long period of time of being focused on our North Star, which is to make sure that people who need it, regardless of who they were, how much money they made, would have access to care. And so we're still trying to do exactly that, but in a modern context. But that's why Regeneron chose us as the partner. And then we made an effort to try to bring in the other 3 HBCU medical schools, but that didn't work out. But they came to us initially because of our reputation of being trusted by minority communities. And that was manifested quite clearly in the pandemic when we were called upon. People often say, and I think it's true, people in our community really don't care how much you know until they know how much you care. And that really captures it in a really profound way. And so, we are jealous of that legacy, and we do everything we can do to protect it. And recently, Oracle has decided to move their world headquarters to Nashville, and they want to create a showcase health clinic to demonstrate how technology can allow us to engage the unengageable. And who did they choose to partner with? Meharry Medical College. And again, that's based on the trust we've engendered in communities like the ones they want to demonstrate the technology can be effective in.
So that legacy was recognized along with Meharry's sister organizations recently by the awarding of $600 million in aggregate, but $175 million directly to Meharry's endowment from Bloomberg Philanthropies. Such a powerful statement to have been made, and I think it was so powerful. Maybe this landed specifically for you because of the Johns Hopkins gift that had been made before that, right?
Yes.
And your background in history with Johns Hopkins.
Yes.
How long ago did you know this was likely to happen?
Well, you recall, Marcus, that 4 years ago, Bloomberg Philanthropies gave $100 million to the 4 Black medical schools, and Meharry got $34 million of that. That was specifically to reduce the debt burden of the currently enrolled at the time medical students. So 280 medical students who qualified had $100,000 of their debt reduced by this amazing gift from Michael Bloomberg. And the whole idea was, I believe when he was running for president and he visited Greenwood, the community that was sort of the Black Wall Street that got destroyed through racial violence. It left a profound impact on Mr. Bloomberg, and he started this Greenwood initiative to look for ways to invest in Black communities so that they could actually accumulate wealth. So one of the drivers of accumulating wealth was going to be the professionals in law, medicine, business, et cetera. And one of the impediments for people getting into medicine, for Black students especially, is a financial hurdle. Going to medical school is quite expensive, Not everyone can borrow the money they need to borrow to be in medical school. And the other thing is that our students bring debt with them from the undergraduate studies. So it's not unusual for a medical student at Meharry and other places as well to graduate owing $280,000, $300,000. So if you're going to start out your career with that kind of debt over your head, it might influence your choices. And so that was the first thing that Bloomberg did for us, is that $100 million. But we started having meetings with them about following up on the students, what choices did they make, et cetera, et cetera. So about 2 weeks before the announcement, we were contacted by Bloomberg Philanthropies to say they wanted to plan a celebration reception at the National Medical Association meeting, which is the association formed by Black physicians when the American Medical Association would admit them. And so we were told they wanted to hold a reception at that NMA conference. So we thought it was just going to be to celebrate, invite some of the recipients of the $100 million that we got to tell their stories and all that. A week and a day before the announcement, the 4 presidents were called together. And when we started into the conversation, it looked like we were going to talk about, again, celebrating the first gift. When the lead person for Bloomberg Philanthropies added, and we're going to be announcing a second gift of $600 million.
Wow.
And there was just a stunned silence, right? Because we weren't really expecting that. At least I was not, for sure. And so it was just one of those moments when words just didn't seem to capture the emotions very well. But I had told my team when I first started 9 years ago that if we just focus on our mission and do good work, I believed, and I still believe, that resources will find us. And I think the work we did during the pandemic, the fact that we sent out clinicians who 80% of them served the underserved, there are so many things in our legacy that I think was obvious to Bloomberg Philanthropies. And our 3 sister schools have similar stories, but Howard and Meharry are the legacy schools, and we have the longest. So to me, it was just a sort of a validation that the work we do is important. We contribute to the health of America in significant ways. And Mr. Bloomberg said that when he announced the gift himself personally, that he was investing in a healthier America by investing in our 4 schools. But what really sort of touched me the most, Marcus, is that when Mr. Bloomberg was given the preamble to announcing the gift, he got really choked up when he started to talk about his parents. He explained that when he was a child, he watched his father write checks for the NAACP. And it was curious to him that a white Jewish man would be writing a check to support this Black organization. And when Mr. Bloomberg finally asked his father why he did it, apparently the answer was that discrimination against anyone is discrimination against everyone. And so from his perspective, doing this was a way to ensure that prejudice would not prevail in our country. And he got very emotional and just said that by investing in these 4 Black medical schools, he's honoring the memory of his parents. And that was quite a moving part of the announcement that he made.
I can only imagine how you felt hearing 600 million.
Yes. On so many levels, this was just an extraordinary thing.
Let's try to wrap up this particular season with maybe a message of hope for the listener. I mean, I don't see how you couldn't take some hope away from what we've talked about so far.
Yes.
But at the same time, it is, I think, for a lot of people, at best, a weird time, if not a really challenging time. Economically, we've had a major bout of inflation for quite some time. Culturally, it does feel like a challenging time here in America, but quite frankly, around the world. And for people in healthcare who really care about healthcare, if you're in this industry, you're doing it because you believe in humanity, and you're doing it because you want to be part of the right side of things. What would be your words of encouragement to folks who are trying to keep hope alive and make a difference?
Well, it's clearly a weird time indeed. And the political division in our country is threatening a lot of things. But I think that everyone would agree, whether you're on the left or the right, that everyone should have the right to pursue optimal health. And we now have some tools and some pathways to get there that we just didn't have before. And when I started medical school in 1982, there were certain diagnoses that were, you diagnose it and you treat the symptom, but you know the person. Now some of those same things, if you catch them early enough, you can completely cure the person, which is just an amazing thing. I also make the comment often that since Laennec invented the stethoscope back in the early 1800s, technology has been separating the provider and the patient in very significant ways. And from my perspective, we may have come full circle because now technology, especially artificial intelligence, can do some of the things that demanded the physicians or the provider's attention, can do those in the background, and now we can have more time, physicians, to spend with the patients to make that connection. And I'm excited about that. I'm also excited about what artificial intelligence may do in terms of allowing us to take multiple streams of information that may have seemed unrelated, lifestyle, your genome, where you work, your built environment, all those things together might allow us to come up with much better treatment plans for patients. And it's the ultimate personalized medicine that takes into account the social determinants of health, and all those can be sort of synthesized and then used to make sure we're giving the person the best hope or best pathway for optimal health. The other thing I'm excited about is, based on what we learned from the pandemic, is the idea of bringing public health and primary care medicine back into the same space. Because I think if that happens, we'll see physicians able to not just improve the health of one patient at a time, but perhaps impact the health of whole populations of individuals. And that, to me, is really exciting. So I think, like in science and biomedical research, we've made leaps and bounds that just seems to be increasing exponentially. I think the same thing can happen in healthcare if we have collaborations across different disciplines, as I referenced earlier, and we keep our focus on the most important thing, which is the best outcome for the people we care for. And I guess, my job that allows me to interact with hundreds of brilliant 20-somethings every day gives me hope, because I know that, especially if they choose to collaborate with each other, some real magic is going to happen. So we just have to keep them excited, not let them get too cynical about the world. And I think, we're going to be okay. Because these are the people who are going to be taking care of at least my generation. So we want to make sure that they are well-trained, they are focused on the right things. But to me, it's all positive. I'm just excited, really excited.
Well, Dr. Hildreth, it's been a pleasure. Always is. And thank you for the way that you lead. You are making an incredible impact in the entire world. And I just want to thank you for how you've chosen to live your life.
That's very kind, Marcus. Thank you. And I just feel honored and privileged to have the job I have. Thanks for listening to Public Service Announcement. To follow along on the rest of our journey, visit www.mmc.edu. And please remember to follow, rate, and review this show wherever you get your podcasts.